Hi everyone, a blessed day to all of you. Praying that all of you are doing well and safe together with your families and loved ones. So, in this presentation, I'll talk about chest physiotherapy. This is the part 1 of our topic on chest physiotherapy. So the other part or the demonstration is on another video. Chest physiotherapy is a treatment techniques that improve lung function. It is a method for clearing the fluid or mucus out of the lungs. It is actually done by clapping or vibrating on the chest or the back of the client, or by placing client in a certain position to help move mucus or fluid to the larger airways, where it can be coughed out easily or it can be suctioned. So the purpose of chest physiotherapy are the following: to loosen secretions in airways, to drains and removes excessive secretions, and to decrease accumulation of secretions in the unconscious or weakened clients, especially those clients who have pneumonia, or those clients who are comatose or bedridden. And even chest physiotherapy is applicable for those patients who have COVID-19. Okay, let's proceed. So, in doing this procedure, make sure that you have to apply what you learned in your nursing process. Of course, in every procedure that you will do with the client, you always apply the 5 steps of your nursing process, wherein the first step is to do your assessment. You have to do assessment before doing your chest physiotherapy procedure. Make sure to know the normal range of the patient's vital signs. Check the respiratory rate of your client, the vital signs or the blood pressure of your client. Also know the patient's medications if your client is taking any medications that might be contraindicated with the procedure. Know the patient's medical history, especially the past history. And know the patient's cognitive level of functioning, if the patient is able to understand the procedure that you are going to perform with the patient. Because if the patient did not understand, baka isipin niya or baka magalit bigla yung patient na pinagpupukpok mo yung kanyang dibdib or likuran. Okay. So, beware of patient's exercise tolerance. That is why it is important for you to check if the patient has an experience of chest physiotherapy procedure before, if the patient was able to tolerate the procedure or not. Alright. Also check the clinical findings and investigation. Okay, make sure to check the detailed history of the patient, the past medical history, or the present illness. The physical examination, actually you have done this before during your health assessment, wherein the techniques included in your physical examination is doing the inspection, palpation, percussion, and auscultation. And it is very important for you to note your findings before proceeding with the procedure. Also do investigations by checking the record of or the laboratory result of the patient, like the x-ray and the blood investigations. If the patient has bleeding and clotting parameters, or check the bleeding and clotting parameters of the client, because baka magkaroon tayo ng baka very sensitive yung client bigla mong na-fracture, no, nalakasan mo, nako, yung baka magkaroon tayo ng bleeding problem. Okay, so make sure that you check all of this or assess this following. Alright, so indications. So, chest physiotherapy is indicated for the patient who has the following conditions. Number 1, or example of the conditions lang, no? Cystic fibrosis. So, as you can see in the picture, here, there is a thickened mucus in the airway with a patient with cystic fibrosis. Cystic fibrosis is actually a genetic disorder that causes a thick and sticky mucus build up in the lungs and in the other organs. So, very sticky. So, mahirap itong ilabas ni patient kasi very sticky. So, that's why chest physiotherapy would help loosen these secretions. And another one or another condition is acute atelectasis. As you can see in the picture, this is the normal lungs and the collapsed lungs, or from the word collapse, no? Nagkaroon na ng lung collapse, wala ng air, in which the larger airways and the lungs are actually nagkaroon nga ng problem. And or collapse of the tissues. Okay. And another condition here is acute bronchiectasis. Okay, so looking at this picture, so nagkaroon din ng dilated airways. Actually, this is a condition wherein the large airways in the lungs are damaged and widened. So, nagkaroon din ng maraming secretions here. And then, another one or another example. Okay, so we're done with the example. Let's proceed to the contraindication. So, you should not, from the word contraindications, you should not do the procedure in the following patient who have active hemoptysis or blood in the sputum, or there is a rib fractures or metastasis, or those patients who have lung cancer, active pulmonary embolism, and those patients who have bone density deficiency, madali kasi silang ma-fracture, and those patients who have recent spinal injury or surgery. So, take note of this, na hindi po natin pwedeng i-perform ang procedure. So, once you're done with your assessment, it's time for you now to create your nursing diagnosis before you proceed with the procedure. So, these are just sample of the nursing diagnosis in the patient who have problems in the lungs or airway. So, number 1 is ineffective airway clearance related to excessive secretions. Another is D4 infection related to retained secretions. And another one is deficient knowledge related to purpose and the technique. So you can still find another nursing diagnosis for your patient. So depende sa case ni client. So as part of your outcome identification and planning, we have here an example, no? So the client's respirations are within 14 to 20, which is the normal, of normal depth, smooth, and symmetric. So this will be your plan, because during your assessment, you were nakita mo the patient's RR is, let's say, 28. Okay. The breath sounds are clear in the target areas is another outcome identification or your target. So the client remains free of signs and symptoms of infections. Like, hindi siya nag-develop ng fever. Diba? Hindi nilagnat si patient, which means hindi nagkaroon ng infection. Okay. So let us now proceed to the techniques in chest or in doing the chest physiotherapy. So here we have percussion, so as your first technique. So it's a chest percussion that involves striking the chest wall over the area being drained. And percussing lung areas involves the use of cup palm to loosen pulmonary secretions so that they can be expectorated with ease. So, meron tayong video, another video, para mas makita ninyo how to do this. Okay? And another one is percussing with the hand held in a rigid dome-shaped position, the area over the lung or lobe of the lung to be drained, instruct in rhythmic pattern. So, cupping is never done on bare skin or performed over surgical incisions or below the ribs or over the spine or breast because of the danger of tissue damage. Okay? So, you have to take note of this. And typically, each area is percussed for 30 to 60 seconds several times a day. If the patient has tenacious secretions, the area must be percussed for 3 to 5 minutes several times per day. Patients will learn how to percuss the anterior chest wall as well. You can teach the client. So this is how, no, ito yung rhythmic or yung proper way kung saan nakacuff yung hands, no. This is how to strike the back or the chest of the client. So another technique is vibration. So the nurse uses rhythmic contractions and relaxations or her arms and shoulder muscles while holding the patient flat on the patient's chest as the patient exhales. So it is also demonstrated in the other video. So the purpose of doing the vibration is to help loosen respiratory secretions so that they can be expectorated with ease. Okay, vibration at the rate of 200 per minute can be done for several times a day. So to avoid patient causing a discomfort, vibration is never done over the patient's breast, spine, sternum, and rib cage. You have to take note of this. And can also be taught to family members or accomplished with mechanical device. So you can teach the family members so that kasi not all the time you will be around, you know, especially if the patient is in the ward wherein you will be handling more than 20 patients. So it would be difficult for you to do the procedure every now and then. So take note of the following proper position when you do the procedure. Okay, so here, this is an example of how you will position the client, no? So you have to check muna sa x-ray kung saan mas marami ang secretions or mucus. Okay, and then kung anong area or part of the lungs ang iyong i-drain. Let's say for example here, you want to drain the posterior. So there's the dots, no? You can see the dots on the lungs. Okay, you will be draining the posterior apical, okay, apical segment. So you have to ask the client or place the client in sitting position na naka-bend, okay, over his or her knee with a pillow underneath, okay, under sa kanyang knee. So another example here, so if you are draining the anterior segments of the lower lobes, no, anterior segments of the lower lobes, You can place the client in Trendelenburg position, wherein you have to raise the bed at least 18 inches. You can also check your checklist for specific measurement kasi sa inyong checklist it is in centimeter. So that's so on and so forth, no? Depende kung ano yung i-drain natin. So I will not discuss each of the position. Okay? So so this is just another illustrations of how you will position your client or another postural drainage position. Okay, for adult, so yung napakita natin picture in the previous slides, ito lang yung pinaka-description again. Okay, this is the lung segment in the recommended position for adult. So if you want to drain the bilateral lungs, you can place the client in high Fowler's position. So if you're draining the apical right upper lobe anterior segment, you can place your client on sitting on side of the bed, supine with head elevated. And then, if you're draining for the left upper lobe anterior, you can place the client in supine with head elevated. If you're draining for right upper lobe posterior, you can place your client in a side lying with right side of the chest elevated on pillows. If you are draining for the left upper lobe posterior, you can place your client in a side lying with left side of the chest elevated on the pillow. If you are draining for the right middle lobe anterior segment, okay, you can place the client in 3/4 supine position with dependent lung in Trendelenburg position. So the right middle lobe or posterior segment naman, you can place your client in prone with thorax and abdomen elevated. So para maintindihan nyo to, you can have the other illustration kanina, yung picture kung ano ba talaga yung itsura ng patient. If you're draining for both lower lobes anterior segment, you can place your client in supine in Trendelenburg position. Okay, nakasupine but nakahiga, nakataas lang yung paa niya, ibig sabihin. So if you're draining for the left lower lobe lateral position, you can place the client in right side lying in Trendelenburg position. And if you are draining for the right lower lobe lateral segment, you can place your client or position your client in left side lying in Trendelenburg's position 2. To drain the right lower lobe posterior segment, you can place the client in prone with right side of the chest elevated in Trendelenburg's position. If you are draining for both lower lobes posterior segment, you can place the client in prone in Trendelenburg's position. For a child, if you are draining for bilateral apical segments, you can place the client or let the child sit on the nurse's lap and lean slightly forward, flex over the pillow. To drain for bilateral middle anterior segment, let the child sit on the nurse's lap, leaning against the nurse. To drain the bilateral anterior segment, you can place the child in a lying supine on nurse's lap. The back must be supported with pillow. Okay, so this is an illustration, no? Ito yung pagpe-perform ng kanyang chest physiotherapy. Okay, pwede nakalin, okay, nakatalikod, or prone position si patient over the lap of the nurse. Alright, let's proceed. Please take note that in doing the procedure, there might be complication, unexpected, no? Even though you did your assessment, just in case lang, these are the possible complication. There might be a position-related hypoxia. Just try to imagine you will be placing your client in Trendelenburg position, wherein, di ba, kahit nga tayo, hirap tayong mahiga ng walang unan. How much more kung mas mababa yung head part at nakataas ang paa. So, sometimes nahirapan tayong huminga. So, there might be aspiration of secretions in other lung regions. So, you have to be careful as well. Or, might lead to postural, diba? Yung hypotension. Okay? So, we have a video presentation kasi after we have our plan, of course, the next step in your nursing process is the intervention or the implementation of your plan. So we have this video is on a separate file now, so you can watch it later. Alright. So each treatment session can last between 20 to 40 minutes. So chest physiotherapy is best done before meals or 1.5 to 2 hours after eating. Of course, to decrease the chance of vomiting or yung complications that we mentioned a while ago about aspiration. So, mas maganda siyang gawin early morning and bedtime, which are usually recommended. Okay. So, once you're done, you have your assessment, you did your diagnosis, you did your plan, and do the procedure or the implementation or the intervention. No? Let's now proceed with the evaluation. So, this is an example of your evaluation wherein your desired outcome met or yung plan mo na met mo. The breath sounds clear to auscultation in all lung fields. So, meaning, natanggal mo na yung mga secretions. Desired outcome met. Respiratory rate is 14 breaths per minute and without retraction. So, walang hirap. So, ibig sabihin, kasi na-clear out na. You have to remember that when you do the chest physiotherapy, you are, the main purpose is actually to help your client breathe normally or easily or freely. And, of course, to improve oxygenation of the client's body. So, another evaluation here, desired outcome met. So, met lahat ng ating plano. Productive cough with expectoration of moderate amount of white sputum. So, ibig sabihin, kung kanina hindi siya makaka-cough, hindi niya maiubo, ngayon, ilabas niya na. Kaya may productive cough tayo. Okay. Parang pwede sa akin tuwa kasi may cough ako ngayon. Okay, so of course, when you do a procedure, you should not forget to do your documentation because as it was said that anything that is not written is not done. So it is very important that you do your documentation. Okay. Oh my god. I'm sorry for the example documentation. I have to edit this one. Okay, because this is still part of the this is your evaluation actually. So let me pause for a while and do the edit for this. So, okay, this is your sample documentation. You should write the date, okay, of, like for example, September 5, 2021, at 7 a.m. Okay, so postural drainage with chest percussion and vibration performed to the right upper middle and lower lung lobes. Calf production with thick yellow sputum. Positioned left side. Patient tolerated the procedure. This is an example of your documentation. So, this is actually the end of my presentation. So, make sure you watch the procedure in another video clip. Thank you everyone and God bless.